Welcome to another Wellness Wednesday. I am your host, Dr. Kometsi Mukwili, aka Dr. K. Now, May is my Masturbation Month. I was wondering whether it's got to do with the fact that they both start with MA, but maybe May is Masturbation Month. I don't know. In any case, we are going to focus today on male sexual health. Possibly towards the end of the show, we will also touch a bit on male reproductive health, because I would like to find solutions for some of the over 50s like me that may not want to have children anymore. But before that, we will go to Dr. Bunolo Mashishi for her viral insights on COVID updates. But now, please join me as we welcome to our show Dr. Larisse Badenhorst.
Thanks,
Larissa, yes. Is
Thanks,
that right?
Dr. K. That's right.
Yes.
That's
Dr.
right.
Larissa is a GP that has special interest in sexology. So male reproductive health is not a difficult subject for her, and the male sexual health is also not a difficult subject for her. So you may be wondering why we're not touching on female masturbation, female sexual health, maybe for another day. Today we chose to decide to speak about male reproductive health, male sexual health, and masturbation by males. Thank you for joining us. How are you, Doc?
I'm good, thank you. Nice to be here.
Thank you for making the time. And tell us about yourself.
So I got into sexual health about 4 years ago.
Okay.
It actually found me. I didn't find it. I was working as a GP at Intercare, and I got the opportunity to actually join my sexual health in Bryanston at that stage.
Okay.
We've recently moved to Northcliffe, so we are based in Northcliffe now in Johannesburg. Love my job, so that's me.
Okay. Tell us why your choice of, well, how did it find you?
So I've always had an inclination to sexual health, I think. My interest started with HIV. I did my diploma in now I have to go back, 2017.
Okay.
I did
That's
my
not too far
HIV
back.
diploma. I've had 2 kids since memory goes by.
Yeah, no, kids can age.
Yeah.
They age, believe me.
And so always worked with females more often. And then when I got the opportunity to join my sexual health, the male sexual health came part of that, and I actually love doing that as well. I think men are sometimes forgotten, in a sense that we assume people know everything. We assume that men are more sexual beings than females, and that's just an assumption. And I think that's why we tend to kind of forget about men, and we focus more on females.
Does it have to do with the fact that now females are expecting more out of males now? Women expect more out of men now. That men have to check up their act, and that's why you're helping us today?
So I think there's a lot of pressure on men from society. Yeah. I think a lot has changed over the years, in the sense that men are always seen as they want sex every single day. You can just flick a button and a man will be ready to go. I think that's a complete.
Yes.
I still think it's a misconception. Testosterone
18-year-olds.
fluctuates.
Yo.
Yes, put them in matric exams. I don't think they're going to feel like having sex in that stressful situation.
Not 18-year-olds, but that's the story for another day.
So testosterone fluctuates during the day, during the month, during the year, depending on where they are in their lifetime.
When you're 40 years.
Yes.
When you're 21, no. It's high all the time.
So, and I think, I think performance overall, not just sexual performance, I think from overall life performance, successes, is a lot on men.
Yes.
Yeah, so I think it's important to let them know what's normal, what's abnormal, where can they find help if they have an issue.
I'm glad you're touching a bit on the psychology of it all. And I when preparing for this topic, I summarized it as, if I can get her to speak about 2 things. We know this is all about testosterone, number 1. 2, okay, I think so anyway, because testosterone is the overall hormone. Androgens, you can put them in a group, you would know better. And because androgens being low is also responsible for male penile shrinkage, something like that. So androgens, testosterone. And I also thought if we could speak about how can I get a vasectomy, something like that. Maybe not me, but maybe me, but you never know. I got 3 kids already, I'm over 50, and I never thought I would be saying this. But in any case, so you have a lot of interest in the sexuality of males, among other things. And we just touched on the fact that the psychology is important. How important is the psychology, do you say?
So our brain is our most powerful sex organ that we have. And no part
Isn't
of
it
sexual
the eyes?
health. No, your brain. Remember, the eyes connect the brain. So,
Okay.
and it does play a very big part in all sexual dysfunction. I think we sometimes put it aside and think there's a quick solution to a problem. And unfortunately, because our brains play such a big role, psychology is a very big part of sexual health and sexual dysfunctions.
And things can go up or down.
Yes.
Can I be hypersexual because of my weird mind?
Weird is a weird word to use.
Okay.
But yes, your mind can play a role in hypersexuality as well as hyposexuality, yes.
Okay.
Yes.
The most common one that we would like to sort out if it permeates is hyposexuality. How do we navigate that? What are the typical examples?
Hyposexuality.
Yes.
Okay,
Where
so
you have basically low sex drive because psychologically you're not in the right space. Let's just put it out there.
okay, so low libido or low sexual desire is a very common issue that we have. I think the biggest problem currently in the world is stress, which plays a role. And the best analogy that I actually read about the other day and heard is that our stress responses is as if you're in a situation that a lion is running at you. And if a lion is running at you, the first thing that you're going to think of is not, ooh, sex would be great right now.
Yeah.
It would be like, I need to get the hell out of here.
Yeah.
And that's exactly the same thing that happens when we're in a stress response. It is normal to go through certain stages in your life where you have a lower sex drive than before. Stress plays a very big part. Small kids, lack of sleep, things like that do play a role. It's when that low sexual desire or the low libido is longer term that it becomes an issue.
Yeah.
So we must realize that there are certain stages in your life where you are going to have lower sexual desire than other times, but it's not necessarily abnormal.
Okay. So off days are okay for both genders.
Yes, yes.
The-
Off days are completely normal. And the thing is, there is always going to be a certain amount of sexual desire discrepancies in a relationship. You will have a partner with a higher desire and you will have a partner with a lower desire. The problem is that if that discrepancy causes the other person to feel that they're not wanted or there's relationship issues between them or it causes distress in the relationship, that's when it becomes a problem. But it's not necessarily that if you're the lower desire partner that the pathology is with you.
Yes, yes, yes.
Yeah.
So somehow you are saying it's not always one partner.
No.
It goes up and down.
So I always tell the patients that I see that this is a couple problem. This is not an individual problem to sort out. Yes, an individual comes for a consultation to seek help with it, but it is very important for the couple themselves to actually talk about it, to get a way to work around certain things, to schedule sex if you're going through a certain time in your life where it's impossible to
scary.
kind of fit it in.
Scheduling sounds scary.
So it sounds very unromantic, but look, if you think about it, there's always someone in the relationship that was thinking about sex before it actually happened.
Okay.
So someone was indirectly planning it anyways. So now all you're doing is you're setting a date to it. So if you have a date night on a Friday evening, once a week, you've got small kids, there's really no other time during the week to do it, then Friday night is your sex night. And if that's the way that you get around it for a certain amount of time in your life, then that's good.
Are you encouraging once a week, Doc?
No, at least.
I'm not speaking for myself here. No. At no stage will anything be about me.
So at least once a week is good. So if you actually go and look at the definition of a good sex life, it's 4 times a month.
But they say the prostate does better if it's evacuated. Oh, that's why we're talking masturbation. Now I get it. It's evacuated, what, 21 times, 23 times a month, more or less?
Yeah, there's always numbers. You know, I never understand how, if it comes to sex, there's always a number. There has to be a normal number. There's no normal number if you really think about it.
Like number of rounds.
I mean, number of rounds, number of times a month. I really think people should be more inclined to focus on the quality of sex
Yes.
versus the quantity of sex. You can get couples that are happy and are flourishing with once a month sex. And then you have people that can have sex every day of their lives and they're still not happy.
Number of partners.
Yeah, number of partners is probably a decision that you make yourself. The only thing is, with increase in numbers, you must just be wary of infections. And you
Yes,
must always
yes.
protect yourself.
And also you chip away at the affection sometimes when it's known that you are giving it somewhere else.
Probably, yes, I
Even
think
when
so.
it's not known, you chip away at the affection.
No,
So
it
you
is
probably spend less
known.
time with the person you're supposed to be spending time with. I'm very monogamous.
Monogamous,
Yeah.
yes.
When I get a chance. Otherwise, I'm out of relationships most of the time anyway. It's never about me anyway. I was going to joke about numbers, meaning 2 minutes. Sometimes it can be quality in 2 minutes. But I don't think so, is there?
No.
No quality in 2 minutes.
No quality in 2 minutes.
What excites you about your job, Doc?
Having an input in the most intimate part of someone's life. And I think that is what I love about a journey with a patient, is to actually get them to a place where they're comfortable with the
Okay.
most intimate part of their lives. Whether it is how they identify, whether it is the issues that we solve in the bedroom, whether it is relationship issues to start off with. It's not always a medical thing that they have. It might be psychological, but to be part of that process to get them to be satisfied with where they are.
There's a question here that says, why do you think men are not comfortable? We're speaking of comfort. You want to get people to a level of comfort. Men are not comfortable talking about this intimacy issue generally, except the part where they claim that their shaft is bigger than, At some point it's phones, at some point it's the shaft.
Look, I think ego plays a very big part. As long as you on the I think as long as you're on the good spectrum side, so you the one with a big shaft, then it's easy to talk about it. But once you the one with a smaller shaft, it's not the easiest topic to touch on. I also think in South Africa we grow up in a very conservative country. South Africa overall is very conservative when it comes to sex, and I think the problem is that we never sketch a picture of that sex is pleasurable, that sex is good for someone, that sex is so much more than just wham bam, thank you ma'am, do it with as many people as you want to. We focus so much on what's wrong with sex that we actually don't focus on what's good. And I think that's a big problem in the sexual education side as well, because we never normalize stuff for people. We never normalize stuff for our kids. We don't teach them the right aspect of sex. We tell them, "Ooh, sex is chapu, never do it," and if you sleep with someone, you're going to get 40 STIs, and these are the pictures of the STIs that you can find. And we sketch this negative picture, and I think that's a lot to do why people don't have the courage to actually come out and talk about sexual issues that they are having.
I have kids. Do you think one of these days we could talk about sexuality in teenagers?
So I think we should actually start, and there's a very competent colleague that does tools for talks where they actually teach parents how to have the conversations with your kids. They're never too young to start. And the thing is, you teach them...
Doctor, to start talking or to start doing it?
No, talking.
Oh,
Talking. So you have to teach them from a very young age to have autonomy over their bodies, to teach them how to respect their own bodies. And I think that is what we lack. We tend to kind of focus on the teenagers, and that's where we need to start the conversation. But you actually subtly start the conversation since they are a baby. And it's, yes, different ages allow different topics to be touched on, but it's very important to realize that you start the conversation from a very, very young age. And I think self-esteem is also a big part of that, to teach them that they need to be confident in themselves and to love themselves for who they are and what they are.
So you've had it from Doc. Our future topic will be communication around sexuality. Thank you, Doc.
Yeah.
I mean, we grow from here. We're going forward.
Yes.
The crew is listening, and we're going to organize it. Thank you for suggesting it, because we need solutions. And now, this being Masturbation Month, what can you tell us about how to deal with the taboos around masturbation?
Okay, so I think masturbation is also one of those topics where no one talks about it. It happens behind a closed door. No one does it. I mean, really, like, for goodness sakes, let's not touch on masturbation. But I think the problem for me is that masturbation is just a part of sexual pleasure. And people think that masturbation is just genitals, it's quick, it's over, and it's done, and that's the way that it must be. But self-pleasure is so much more of a warm kind of way to describe it. And self-pleasure involves a lot of things and a lot of ways to do it. And it's not necessarily genital touching, but it's the journey of pleasure. And that is what masturbation should in essence be. It's not something that you do just for the gratification of getting an erection, ejaculating, and it's over and done with. It should be a journey. It should actually be something that you are mindful about when you do it, and not just something that you jack off and get it over and done with, if I can say it that way. Because the thing about masturbation is that, and I love, there's a guy on Instagram, Cam Fraser, that talks a lot about male sexual health and male masturbation. And he describes it as, it's as if you're doing, he uses the analogy of sport. So the way that you practice is the way that you play. And the practice is the masturbation, and the play is the actual sexual intimacy part. So if you are going to kind of do it as hard and fast and get it over as quick as possible, that's exactly the way that you're going to be when you're actually sexually intimate with someone. And that is why a lot of people think, oh no, if I masturbate, then I get premature ejaculation, or if I masturbate, it causes erectile dysfunction. It doesn't actually cause those issues, but it's the way that you do it that can cause those issues. So the harder you do it, the quicker you get it over and done with. That is the way that it's going to be if you're intimate with someone, because that's the way you are inclined to respond sexually.
There's a lot of myths surrounding masturbation, but I'll tell you personally, I've enjoyed reading about people's memes over masturbation on social media, because it opened a door to the possibility that everyone out there is doing it. And I was so happy I'm so happy to always have the conversation. People say, okay, it's good for your sleep.
Yes.
That's what they say.
Yes.
Scientifically, it's been proven that there's a hormone that's released after ejaculation by men.
Yes.
That's why males go. Sometimes they say it's because we avoid the difficult questions.
Oh, no.
What are we?
Oh, shame. No.
In any case, so, but genuinely speaking, the memes have revealed so much. There's one that says, you know that person is a serial killer if they continue watching a sex video after masturbation, because there's no need. You can't overdo these things. You know? So in any case, yeah. So I like the lighter side of it, because it brings it forward, and we can laugh about it, and we will tell you stuff about it, you know? And while speaking of the lighter side and conversation and communication, male sexual health, any way to communicate with our male teenagers?
So I think
male children. It says male children on the question here.
So I think it is important for men to have the conversation with men. The reason why I say that is you normalize it a lot more than when I go and speak to my son, for instance. I do think that it's important to make them realize that it is part of sexuality growing up, finding your own sexuality, it is normal. It's normal for people to masturbate. I think the abnormalities are when it interferes with your everyday living, when it interferes with your intimacy and relationships and doing your job, where you become so self-consumed by it that is the only way
it
to...
interferes with your Zoom meeting, like
Yes,
it happened one of
yes.
these days in the past.
Yes, that's a very uncomfortable thing to happen. But I think that's when it's an issue.
Yeah.
But I do think it is important to, and that's where Masturbation Month actually comes from. It was actually a sex shop, Good Vibrations, what a name for a sex shop,
Yeah.
in San Francisco in 1995 that actually inaugurated May Month for Masturbation Month, because there was a doctor that actually wanted to include it in sex education programs for teenagers, and she lost her job because of it. And that's in essence where Masturbation Month comes from. So I do think it is important to actually include it in sexual education for teenagers. Yeah.
I must admit, I managed to discuss condoms with my son, and I didn't like his response. I've said this on our show before. He said his friends that were also 19 have babies because, I said, because condoms best. I said, not only is it a lie that the condoms best, they never used them, but do you have friends that are 19 that have babies? Or are we just having conversations? But I have never been able to touch on the topic of masturbation. I have 2 sons, and I never make time for it, I must admit. Tell us about the benefits of masturbation. I said sleep.
So sleep is one.
So is there any effect on the prostate if you release the...
So they say that yes, there is a decreased risk of prostate cancer if you ejaculate more than not, but it's not, the studies are too
few and far between.
yes,
So you
to
can
actually go by that. The other advantages is more from an aspect of you learn what your own body likes and what you want from a partner. It also, in men, it can actually help them for the ejaculatory response during sex.
Okay.
So you can actually learn to not ejaculate
back,
too quickly
yeah.
or hold back. The sleeping is the one, and just the satisfaction that comes from the whole experience is also...
Let's
also
not
good.
assume everyone out there has a partner
Yes.
that they can get intimate with. So it is essential in that respect as well. It's not
Yes.
only for lonely people.
No,
Yes, but
No,
it is
so-
essential. It helps.
it's actually one of the myths that masturbation happens more in single people than in couples. There actually has been studies that show that masturbation is actually more common in relationships than it is in single people. So
I've read somewhere, don't ask me why I was reading about does the blue pill help with the long erection? What I was told it doesn't. On the internet it said it doesn't. Not only the blue pill, all the pills are meant to
Yeah.
give you a healthier blood circulation, not necessarily. Yeah.
yes.
You can touch on that if you like. I read that the masturbation does slow down the ejaculation
Yes,
response.
it does.
Yeah.
So it's one of the things that we actually do suggest to people that some of the men that do suffer from premature ejaculation to actually masturbate before they have sex, so that they don't have the urge to ejaculate as quickly if they didn't ejaculate before having sex. It does help because it does delay ejaculation then when you are with your partner.
Do the pills give you longer erections?
So it's not going to help you to decrease the chance of having ejaculation. It will firm your erection, yes, but it doesn't help from an ejaculatory perspective. But it might help to maintain the erection after you ejaculated, which is also something that happens, that you lose the erection after ejaculating.
Okay.
Yeah.
Is there sometimes where they are taking longer? I'm not saying you are doing a prescription here, but someone might have said in small doses they are good for circulation when they are prescribed by the right person for the right reasons.
Yes. So one of the molecules that's actually working that way is tadalafil, which is commercially known as Cialis, for instance, is the one. So that comes in a smaller dosage, and we actually do give that to a lot of patients to help with circulation, because all of these, remember, they vasodilate, so they open up the arteries to have an increase in blood flow. And at a smaller dosage, it was actually proven that it does help. It actually helps the heart as well. So it's actually good in a smaller dose.
I won't hold you to this. What's the dosage again?
5 milligrams.
You don't have scripts in your bag, do you?
I do. We can talk afterwards.
What are the general reasons for someone seeing a sexologist, Doc?
Everything from having low libido, erection issues, just needing contraception, pap smears. We do a lot of pap smears for females. We do a lot of trans communities that we see, LGBTQIA communities. HIV is also one of the big things that we see. And people are always scared to come to someone that does sexual health because we're the weird doctors. We do the weird and wonderful things. But we actually, in essence, just do a very good general health check. Because sexual health is very dependent on your general health.
And communication.
Very, very important.
We're going to handle, let's handle general health.
Okay.
Yeah, male general health, male sexual health. Where do they link?
They
We've spoken about this before, but it's not important.
So it's a very, very good big link between general health and sexual health. If you are not well from a physical or an emotional or psychological aspect, you are not going to be healthy from a sexual health perspective. We don't go and look at weird and wonderful things that can be wrong with you when you come in with, for instance, low libido or erection issues. We test the common things. Men with diabetes, men with high blood pressure, cholesterol issues, prostate issues, just general stress can also play a very big part in sexual health. So it's not weird things that cause sexual dysfunctions. It is common things. And that is why we so focused on, if you have erection issues, to go and see someone, because it can be a very big alarm for something bigger to be a problem.
And exercise helps a bit?
Lifestyle is very important. I think we underestimate how much good, healthy diets and a good exercise regimen actually plays a very big role. Especially when it comes to general conditions like diabetes, high blood pressure, cholesterol, and to actually stop you from getting those. So it's actually from a protection mechanism as well.
On a lighter side, there was a time where we used to say, a man with a belly in my circles,
Yes.
10 years ago, looks like he's successful, blah, blah. But until you find women of that same age, 35, 40, going for men of younger age because they don't have the belly. It must say something. There's a link there.
They look healthier
Who they?
without a belly.
Yeah, but then they also, do they perform better?
Not necessarily. So if you're going to use steroids to look better, you are going to have a lot of sexual issues when comes the time.
Thanks for saying that.
Yeah. The other thing is, remember, increase in weight can be correlated to low testosterone levels.
Okay.
So it's important to go and check your testosterone, to go and check your sugar, to go and check your thyroid, because all of those things can influence you to develop a little bit of a belly. Yes.
And one of the ways of increasing your testosterone is doing resistance training.
Yes.
In the gym.
It is. Yes.
A bit of cardio here and there, a bit of resistance training here and there.
Yes, mixture is very good. Yeah.
Okay.
And exercise is a natural increaser for testosterone.
Exercise.
Yes.
Okay.
Exercise.
Yeah. Communication, Doc. You and I are saying this. Someone is watching us now. But how do they communicate to their partner without bringing them to the screen? Obviously, must tell them to watch this episode because it's available on YouTube.
Yes.
And so how do they communicate better?
So when couples come to me, I always tell them that...
What if one, sorry to interrupt you,
Yes.
What if one person comes to you? How do you unlock their
So
communication?
I always encourage them to bring their partners along for the second time that they come. They don't necessarily come the first time with a partner if they're comfortable, obviously.
Okay.
The thing for me is that we focus so much on sexual intimacy, but if you're that intimate, how on earth are we not able to communicate about it? And that's the sad thing about couples, because I can't say penis or vagina in front of you and then I blush. But yet you are inserting your penis into the vagina, but we don't talk about it. And the thing is,
it's quiet when they do it.
yes,
So
well,
there's no
it's
need
not
to-
supposed to be quiet. That's uncomfortable to have sex with someone just lying there and not saying a word and like no noise, no sound, nothing.
There's kids in the house, Doc.
I'm sorry. PG.
No, when you're doing it, sometimes there's kids
Yes,
in
well,
the
that's
house.
true. That's true. But communication around it is very important. It's no use jumping in bed and not knowing what the other person enjoys. And I think that's a lot of times where the miscommunication comes in. You feel that he just wants to get it in, get it out, and go on, and she would like it a little bit more intimate, a little bit softer, a little bit longer foreplay. So communication around what the expectations are is very important. How to start that conversation is a little bit more difficult. But you can always, for instance, like I tell them, say, I watched this thing on YouTube, for instance, this conversation, and they were talking about communication. What would you say? And that's a nice thing to start the conversation with, because the thing is you use someone else to kind of like get the intro going. And that's an easier way to actually get a conversation going versus just to like start in the middle of a conversation with like, yo, what do you enjoy kind of thing.
It helps a lot to overcome these things and to do them well if you like each other a lot.
Yes, that's true.
Because when you suggest something to me, I'm not always paranoid. Because, but half the time marriages are between people who don't like each other.
Then they shouldn't be married. So I think there's a very big misconception when it comes to why do you want to remain married to someone that you don't like? Is it for advantages from a financial perspective?
Yes, it's done all the time.
It is done a lot.
Yes.
But then the thing for me is if you're in it for that reason, then there must be a very
Then there would be
good...
no marriage.
That's very cynical.
I'm being honest. I'm
I'm happily married.
There are people that get married because their parents are saying, yeah.
No, that's true.
Yes.
That's very true. But I think if both parties are in it for that reason, then surely there must be more communication around what the expectation of each is. I don't know. That's just me. Maybe I'm living in a dream world. But I think communication around what the expectations are is important. And I think that's where the problem comes in a lot of couples. If you don't like each other, yeah, sex is not really going to be the highlight of your week. But yeah.
You know, I've managed to stay single for so long, not that I like it.
Yes.
I think one of these days, I'm going to go for couples therapy on my own, just as a side issue.
To sort out problems with you
With
and
me.
your ghost.
and me, you know. Yeah, pain during ejaculation, Doc, it's a social media question.
Not
Is there any
normal.
significance to that?
Not normal. You
Not
shouldn't
normal.
have pain with ejaculation. So there can be infection, which is one very big part. Infection, and that can be, remember that system is not just one pipe, one problem.
Yeah.
There's many areas where there can be issues. So infection is one big thing that you need to exclude. So it's important to see a doctor
It's
for
not
that.
one pipe, not one problem. It's not one bug.
Yes.
I believe there's instances where bacterial vaginosis starts as an innocent overgrowth of bacteria. And does it lead to some kind of STI eventually?
So not bacterial vaginosis necessarily, but how I describe it to patients is, remember, bacterial vaginosis, if you have to explain it simply to someone, is that your vaginal flora is de mekaar. That's basically what it means. And if the vaginal flora is not what it's supposed to be, the chance of then getting an infection on top of that is much easier because it's not a healthy environment.
I see what you mean.
So it's much easier to actually then get another infection because the protectors within the vagina, which is the lactobacilli, are not working the way that they should.
Okay. So it's always advisable to gravitate towards condoms as much as possible initially?
Yes.
Before you do, what kind of tests do we do so that we can know that?
Okay. So
Obviously, both partners do tests,
Okay,
whether
so-
it's in a heterosexual, homosexual, or whatever relationship.
Okay, so the important thing is blood test is for
Yes.
3 things only.
Yeah.
HIV, hepatitis B, and syphilis.
Okay.
Those are the only 3 that you can accurately diagnose on a blood test.
Okay.
Then I tell my patients, where do you get penetrated? Or what do you use to penetrate with? Because that's in essence the focus of where the infection would be. I am not focusing on your throat if you didn't have ejaculation into the throat, for instance.
Okay.
Okay, so for females, if they have, and I'm talking completely cis female now, cis is someone that identifies the same as the sex that
Okay.
they were born as. So if she gets penetration into the vagina, where would the infection be? Vaginal. So we do a swab of the
Okay.
vagina. If you get anal penetration, we do a swab of the anus. If you
Okay.
use your penis to penetrate, then we do a urethral swab.
Okay.
And that is for gonorrhea, chlamydia, trichomoniasis, and then uroplasma, mycoplasma. So those are the big infections when it comes to STIs that they test for.
And urine samples?
Urine samples make sense in men because
Okay.
it's the same. The urethra, where the
Yes.
ejaculate comes out of, is where the urine comes out of. So the idea is that if there is an infection there, it sloughs into the urine and you find it in the urine. In females, it doesn't really make sense because the urethra and the vagina are 2 separate entities. So it's the chance of getting an infection in your urethra that you're going to get into the urine is very unlikely, except if there's contamination from the vagina.
Okay.
Yeah.
Well, on a lighter note,
Yeah.
toys for men?
Toys.
Yes, it's a social media question.
Okay, so there are many toys out on the market. It really just depends on what you want out of the toy. Do you just want stimulation?
At the moment, I
Do
don't
you
know
want-
what I want. Just
do you not
enlighten
know
me.
what you know?
Yeah.
Okay, we'll talk afterwards to
No,
kind
let's
of
talk
clarify
now.
that.
There's a lot of us out there who don't know
So the
what they
thing
want.
is, you get a ring, which is very common
Yes.
in men now.
Okay.
That comes with a vibrator, without a vibrator. You get a lot of couple vibrators, for instance, that satisfies both. You only get ones for females. You get ones that insert into the vagina, that don't insert into the vagina. You get ones that go into the anus. So it really just depends on where do you want the pleasure to come from
Okay.
and what kind of stimulation you want. But there are so many on the market.
I think we're about to go viral now to Dr. Mashishi to get updates on COVID. Tell me, there's misconceptions about male masturbation. We handled a few of them. Is there one that strikes you at the moment that you would like to mention?
So I think the biggest misconception when it comes to masturbation is that you need to always do it alone. That it's never with a partner, and that you have to do it quickly, get it over and done with, and it's done. I think that those are the misconceptions that are out there when it comes to masturbation.
Okay, but it's okay to do it alone, right?
It is okay
I'm not
to do
asking
it.
for
No,
myself.
no,
It's
no,
okay.
no.
Okay, now we go viral with Dr. Bonolo Mashishi for COVID updates. Over to you, Doc.
So unfortunately, no, we don't have self-testing kits available in retail stores, but definitely this has been a conversation that's ongoing, and regulatory authorities are looking and made calls for applications for having these self-testing kits. So hopefully they should be available in the next few weeks or months.
Welcome back, guys. We are still hanging out with Dr. Larisse Badenhorst, and today we are discussing male sexuality because we chose male for some reason, and maybe it's because it's May, because May is Masturbation Month. And Doc, thank you, by the way, Dr. Mashishi, always insightful. We gain a lot from this, except now it's only scary stuff. We are almost in the 5th wave, if you can call it that, yeah. Or maybe we are in it already, you never know. Male reproductive health. Specifically, all my friends want to find out how they can stop making babies without relying on their partners. We are very humane about it. We are very thoughtful. We don't want to pump our partners with contraceptives.
Yes.
Yeah, that's the only reason. Yes.
Okay. So, unfortunately, with contraception, it comes from both sides. Okay. The females have to take responsibility from their side, and the males from them. The easiest way for men, from a contraceptive perspective, is to wear a condom. Okay, which is, I always say, it's no use never having a condom around, and then when you're in the intimate moment to try and then get something on and try and then navigate that. So it is difficult. Vasectomies are an option, all right? Especially if you are done, you don't want kids anymore. It's really not as scary as everyone thinks, and there are a lot of misconceptions when it comes to vasectomies. They say that you're never going to be able to get an erection again, my testosterone is going to decrease, I'm going to lose my manhood. Not at all. The only thing that they do is they cut the duct, which actually causes the sperm to come into the ejaculate. And there is minimal side effects to it, minimal risks. You even have doctors that do it in their rooms under local anesthetic.
Oh, nice.
So you don't even have to go into theatre.
Oh, okay. I wasn't really placing myself in theatre, but let's see.
So that is an option.
So the duct, there's still semen.
So there is still ejaculate.
Okay,
yes.
ejaculate, yes.
Yes, but there's no sperm in the ejaculate.
Okay.
Yes.
Is it reversible?
Can, yes, but with a lot of effort. Yes.
Okay.
It's not the easiest thing to reverse, but yes, it is possible.
Okay.
Yes. And that is probably one big reason why they don't do, or they don't tend to do vasectomies in very young men.
Okay.
Because they do counsel them regarding it is difficult to reverse. If you change your mind in 10 years and you're now only 30, you're only 40, then maybe you find a partner that you want a child with, for instance. But they go through a lot of consent when they then decide to do the vasectomies, the doctors that do them. Yeah.
We've reached the end of our very interesting conversation, Doc. Tell me, before I tell people how they find you on our platforms, can you tell us how they can find you on your own site?
Okay, so mysexualhealth.co.za has a whole team on it. Dr Larisse Badenhorst.co.za is my website.
Okay.
And then I'm on Facebook, I'm on Instagram, I'm on Twitter, Larisse Badenhorst. You can find me there.
Okay.
And then we are in Northcliffe. So everything is on our website, and you can email or call for appointments.
Thank you for coming, Doc. And guys, as always, remember that all our specialists, all our guests, doctors, non-doctors, they can be found on our website, where you go to the menu and you say, find a doctor. You can still find our fitness people there, dietitians, even though whether they are doctors or not, everyone is listed there, and you can make your appointments from there. And remember, now we are in luck, because if you do want to align your brand with our brand and you want to advertise on our show, we will show you up on all our websites, on our YouTube, and also on our social media pages, which are fortunately getting a lot of growth. So you can email us. It's admin@askyourdoctors. It's on the screen. And you can also hit us on the socials, give us a DM. And while you are on YouTube, please remember to press subscribe. And until next time, keep asking your doctors.